going to look at her pelvis, the sacral area, lumbopelvic sacral area, to make sure that her spine and her pelvis move symmetrically left and right, and in flexion and extension. So here's flexion, extension. Don't feel any restriction. I'm going to take her pelvis left and then right. And it feels symmetrical, feels really good. Moves left and right, forward and back, easily both ways. Okay. So since she's feeling better and her head is filling out more normally, front and back and side to side, she still has a minor flattening on the left side here. What I would recommend is that since she is benefiting from this manual therapy, you could do one last time, like maybe within the next month, and then that'll take her to how old?
She'll be 8 weeks, so in the next month, 12 weeks old.
Yeah. Okay, so if within the next month I work with her and her head looks even better than today, because she only has a minor restriction here and in the back of the head, but I actually loosened it up already. If she looks like 98% better total, then I would recommend that she gets seen by a physician or PT who does the osteopathic work at 6 months and every 6 months until she's 3 years old. Because we want to make sure that the head develops symmetrically, front and back, side to side, and that her spine follows, and that we can avoid malocclusion, biting problems, breathing problems. And as she crawls and bumps her head, or walks and runs and bumps her head, it's good to have her head checked every 6 months.
Okay.
And then around 3 years old, the head starts to get harder, and then hopefully by then everything just checks out fine.
Great.
So just a little minor work that needs to be done still on the left back of the head, but her neck feels good. Moves symmetrically left and right. The CRI is good at 12 times a minute. That's within the normal range of 10 to 14. And that's the expansion and contraction.
Okay.
Kathy, can you just explain what may happen during the actual delivery when an infant's head goes through the birth canal? Why certain areas of the sphenoid bone, in particular, it seems to find the problem with the sphenoid bone? Could you just explain that?
Well, if the head displays some sort of asymmetry, it can be a result of a number of things. It can be that perhaps they developed a little bit squished in the pelvis, or the head may actually be okay and symmetrical, but then when the baby passes through the birth canal, depending on how the baby is delivered, if it was suctioned out, or if the mother's pelvis is not symmetrical, it can lead to the formation of a plagiocephalic head. So all babies need to be checked whether or not they have asymmetry or plagiocephaly or torticollis, or if they're symmetrical. All babies need to be checked every 6 months. Did that answer your question?
Yes, thank you.